The Prime Minister and the Premiers have met, more tens of billions of dollars to healthcare, no discussion about how it's going to be delivered. Mark Kealey has been on this show before as a stalwart Liberal. He's also in the business of healthcare and joins me now because I've spoken to some doctors who say this is not a solution, just throwing money at. One doctor in particular said, we need a discussion as to how to deliver health services to individuals. And he said, we do not have enough doctors now. Let's talk about, almost paramedicals. We need to discuss more options.
Well, listen, this is a very good time to start this, Stephen. I'm going to challenge you. I think one of the things that you with LeDrew could do is maybe challenge the entire system to a debate or have that kind of richer discussion. Let me just tell you.
What are the things about the options? Why aren't we discussing those options?
Well, I think there's a fallback, and the fallback is always the Canada Health Act. When you listen to politicians say Canadians love their system. Well, I don't know very many Canadians with whom I speak right now that are happy with the system as it is. And and the problem we have is, we're getting through wait times on surgeries, elective surgeries. No, it's compounding, Stephen. It's compounding daily and daily and daily.
And there are towns and cities across Canada with no doctors at all.
Correct. But there are systems, and here's the issue that we've got. The Prime Minister is getting blamed for this, when really, when you look at this, it's really the healthcare systems in each of the provinces. We have 13 systems based on our Constitution, right? The Canada Health Act says, well, look, from the federal government's perspective, we're going to tell you what can or can't be done. That translates down under Section 93 of the Constitution to the provinces to run the system. And I got to tell you, the premiers in this country are getting mercilessly kicked in the head for something that their systems are not doing.
So why aren't we fixing the systems? Even if there's 13 different systems, why are we not having, ministers discussing it or premiers having debates about or discussions of, here's an option. And we'll have more doctors coming in from around the world, and we're going to accredit them.
I agree with you, but for the analogy I use is the securities commissions.
Right.
We have 13 securities commissions in this country. It's ridiculous to get anything on the publicly traded markets done. But if we look at it in the context of healthcare, it's the same damn thing. So I think if we looked at the premiers are saying right now, let's have this discussion, then agree on something. And if you're going to agree on something, let's agree on exactly what you said. Let's agree on accreditation. There are 5,000 Canadians who are in medical school outside of this country. Do you think that they could come back to this country to practice? No. There are thousands.
So why isn't that happening? We are sending kids all around the world, and they're becoming really good doctors, and they can't get accredited. Ontario, the College of Physicians say, well, no, we don't like that school.
Well, I think, in a lot of ways, the colleges have to look at that in terms of quality. But this is a richer discussion, Stephen, and it's very, very, very complicated, but at the same time, it's very political.
And we need the politicians to get involved with the doctors. Mark Kealey, good ideas. Thanks very much. 3 minutes. The Trudeau subsidized media cannot engage you in the discussions. They can't even present the discussions that we do here on this channel, which are critical to the health and future of Canada. So, to help us keep broadcasting, please contribute financially. The address is below. You can write a check, PayPal, and please subscribe.